Heart attacks, also known as myocardial infarctions, occur when the blood supply to a part of the heart is severely reduced or completely blocked. This blockage is most often caused by a buildup of plaque in the coronary arteries, the blood vessels that supply blood to the heart muscle. This plaque buildup, called atherosclerosis, gradually narrows the arteries, reducing blood flow. Eventually, a piece of plaque can break away, forming a blood clot that completely blocks the artery, leading to a heart attack. Causes of heart attacks. Atherosclerosis, the most common cause, as described above. Risk factors for atherosclerosis include high cholesterol, high blood pressure, diabetes, smoking, obesity, and a family history of heart disease. Coronary artery spasm, a sudden narrowing of the coronary arteries, often triggered by stress or cocaine use. Coronary artery dissection, a tear in the inner layer of a coronary artery, which can lead to a blood clot and blockage. Blood clots can form in the arteries, even without significant atherosclerosis. Conditions like atrial fibrillation increase the risk of clot formation. Preventing heart attacks involves managing risk factors and adopting a healthy lifestyle. Here's a comprehensive approach. 1. Lifestyle modifications. Diet. Eat a heart-healthy diet rich in fruits, vegetables, whole grains, and lean protein. Limit saturated and trans fats, cholesterol, sodium, and added sugars. The Mediterranean diet is often recommended. Exercise. Engage in regular physical activity, aiming for at least 150 minutes of moderate intensity aerobic exercise or 75 minutes of vigorous intensity aerobic exercise per week. Weight management. Maintain a healthy weight. Obesity significantly increases the risk of heart disease. Smoking cessation. Smoking is a major risk factor. Quitting smoking is crucial for reducing heart attack risk. Seek support from your doctor or a cessation program. Stress management. Chronic stress can contribute to heart disease. Practice stress-reducing techniques like yoga, meditation, or deep breathing exercises. Alcohol consumption. Limit alcohol intake. Excessive alcohol consumption increases blood pressure and can damage the heart. 2. Medical management. High blood pressure control. Regularly monitor and manage high blood pressure through medication and lifestyle changes if necessary. Cholesterol management. Maintain healthy cholesterol levels through diet, exercise, and medication if needed. Your doctor can recommend cholesterol screenings. Diabetes management. If you have diabetes, carefully manage your blood sugar levels through diet, exercise, and medication. Medication. Your doctor may prescribe medications to prevent blood clots, lower blood pressure, or lower cholesterol. 3. Regular checkups. Routine health screenings. Regular checkups with your doctor are essential for monitoring blood pressure, cholesterol, and blood sugar levels. These checkups help detect and manage risk factors early on. 4. Family history. Genetic predisposition. If you have a family history of heart disease, you may have an increased risk. Discuss this with your doctor to determine appropriate preventative measures. Preventing heart attacks requires a multifaceted approach encompassing lifestyle changes and medical management. By adopting a heart-healthy lifestyle and working closely with your doctor, you can significantly reduce your risk of this life-threatening condition. Early detection and management of risk factors are crucial. Do not hesitate to consult a healthcare professional for personalized advice and guidance. A heart attack is a life-threatening emergency requiring immediate medical attention. While first aid can't cure a heart attack, it can significantly improve the chances of survival and reduce the severity of damage until professional medical help arrives. Do not attempt to treat a heart attack solely with first aid. It is crucial to call emergency services immediately. Recognizing a heart attack. Symptoms can vary, but common signs include chest pain or discomfort. This is often described as pressure, squeezing, fullness or pain in the center of the chest lasting more than a few minutes, or going away and coming back. Discomfort in other areas of the upper body. Pain or discomfort can radiate to the shoulders, arms, back, neck, jaw, or stomach. Shortness of breath. Difficulty breathing can occur with or without chest pain. Other symptoms, these can include breaking out in a cold sweat, nausea, lightheadedness, or feeling unusually tired or weak. Women may experience less typical symptoms like back pain or unusual fatigue. Immediate actions. 1. Call emergency medical services (EMS) immediately. This is the most crucial step. Dial your local emergency number. Explain the situation clearly and concisely. Keep the line open and follow the dispatcher's instructions. 2. Assist the person to a comfortable position. Help the person sit or lie down in a position that makes them most comfortable. Avoid any strenuous activity. 3. Administer aspirin. If the person is conscious and doesn't have an allergy to aspirin, and their doctor has not advised against it, you can give them one adult low-dose aspirin to chew and swallow. Aspirin helps to prevent blood clots. This should only be done if directed by medical professionals or if the person has been pre-authorized to take aspirin in such a situation. 4. Monitor vital signs. If possible, monitor the person's breathing and pulse. Be prepared to provide CPR if necessary. 5. Stay calm and reassure the person. Your calm demeanor can help reduce the person's anxiety. 6. Do not give food or drink. Avoid giving the person anything to eat or drink. 7. Do not move the person unless absolutely necessary. Avoid moving the person unless it's absolutely necessary for their safety or to administer CPR. Cardiopulmonary resuscitation (CPR). If the person becomes unresponsive, loses their pulse, or stops breathing, immediately begin CPR. CPR involves chest compressions and rescue breaths to circulate blood and oxygen to the brain and other vital organs. Proper CPR training is essential. If you are not trained in CPR, continue to monitor the person and wait for emergency medical services. Important considerations. Time is critical. The faster the person receives medical attention, the better the outcome. Every minute counts. Follow EMS instructions. Listen carefully to the dispatcher's instructions and follow them precisely. Do not delay calling EMS. Do not attempt to drive the person to the hospital yourself. Professional medical help is necessary. After emergency services arrive, provide the EMS personnel with as much information as possible, including the person's medical history, medications, and the onset of symptoms. Follow their instructions carefully. This information is for general knowledge and does not substitute for professional medical advice. It's crucial to receive proper training in first aid and CPR to effectively respond to emergencies. Regular checkups with your doctor, maintaining a healthy lifestyle, and understanding your personal risk factors for heart disease are vital in preventing heart attacks. If you experience any symptoms that might indicate a heart attack, immediate action is crucial. Remember, a heart attack is a life-threatening emergency. Do not delay seeking medical attention. What to do if you suspect a heart attack? 1. Call emergency medical services (EMS) immediately. This is the most critical step. Don't try to drive yourself to the hospital or wait to see if the symptoms subside. Dial your local emergency number and clearly explain your symptoms. Keep the line open and follow the dispatcher's instructions. 2. Chew and swallow aspirin. If you are conscious and do not have an allergy to aspirin, and your doctor has not advised against it, chew and swallow one adult low-dose aspirin. This can help prevent blood clots. However, only do this if you have been pre-authorized by a medical professional to take aspirin in such a situation or if your doctor has advised you to do so during a suspected heart attack. Ignore the symptoms. Even if the symptoms seem mild or go away temporarily, seek immediate medical attention. Delay seeking help. Every minute counts in a heart attack. Self-treat. Do not attempt to treat the symptoms yourself. Recognizing potential heart attack symptoms. Remember that heart attack symptoms can vary, and some experience atypical symptoms. Common signs include chest pain or discomfort, pressure, squeezing, fullness or pain in the center of the chest lasting more than a few minutes, or going away and coming back. While this advice is crucial for acting during a suspected heart attack, remember that prevention is key. Maintain a healthy lifestyle through regular exercise, a balanced diet, and avoiding smoking. Regular checkups with your doctor, including cholesterol and blood pressure monitoring, are also essential. Discuss your risk factors with your doctor to develop a personalized prevention plan. A heart attack is life-threatening, and survival rates are significantly impacted by prompt medical intervention. If you lack the financial resources for immediate medical consultation, preventative measures are crucial to minimize your risk of a heart attack. The following steps are essential to avoid a heart attack when financial constraints limit access to immediate medical care. These steps are preventative, not a cure for a heart attack in progress. If you experience symptoms of a heart attack, call emergency services immediately. A heart attack is a deadly condition, and survival often depends on swift medical attention. Limited financial resources for doctor consultations necessitate a strong focus on prevention to reduce the risk of a heart attack. The following steps are crucial for preventing a heart attack when financial constraints hinder access to immediate medical care. These steps are preventative, not a treatment for a heart attack that is already happening. If you experience heart attack symptoms, call emergency medical services immediately.